Today, if you understand stem cells, then you will know why you can do reverse aging. In the market, you always hear about anti-aging. So today, I'll talk about stem cells. What is regenerative medicine? Regenerate, not rejuvenate, not repair, regenerate. So you are actually made from stem cells, correct? So you want to have new stem cells in your body. So this is where your stem cells come from. Do you understand this slide? Embryo, sperm, you all understand, right? Fertilization. So this is exactly what you are, right? You see that? Fertilization. And at the end of the day, 2 cell stage, 4, 8, and then you see that? Pink and blue cells. You are made from those blue cells. So today, as you age, right, your blue cells will be reduced. Now, see your human body, your stem cells develop your whole body from your hair to your toenails. Everything comes from the stem cells. So today, what is the most important thing in your body? Stem cells. So a lot of people don't understand. I take a lot of supplements, but why I don't get younger? Because they do not regenerate new baby stem cells. Okay, they're just supplementation because the diet, the food that you eat is insufficient. So those are supplement as per the English word saying. So what we need to do is regenerate stem cells so we can regenerate the whole body. So this is the characteristic of a stem cell. Stem cells can duplicate. Stem cells can differentiate. So if you do not understand, because today the talk will be summary, I'm not going to detail. Okay, so stem cells is immortal cells, but the cells actually have what we call a lifespan. They will multiply, expand, and then eventually die. That's why we will eventually die, right? But differentiation. So your stem cells, like for example, if you have a lot of problems with your liver, you're diabetic, the stem cells will go towards the liver and attach to the liver and repair the liver. So if you got a cut, right, the stem cells will go towards the cut and repair. That's why when you have an accident, okay, and you can see that your cells, so if the more stem cells you have in your body, then you will regenerate faster. All right? So this is what we mean by differentiation. You can go towards your organ, your muscle, your nerve, your bone, and other tissues. This is the normal stem cells. So stem cells is the mother of stem cells. What we call that the MSC, mesenchymal stem cells. So the whole body is made from stem cells. So today you understand why stem cells is so important. All right? Can you see from baby, 100%. So those who are mothers, they are the ones that take care of their babies. If the baby get a cut, cut and they bleed, how many days will that wound heal? Will it take 3 days, 5 days, 7 days? Try cutting yourself now, right? You're already aged 40, 50. Take how many weeks to heal? What's the difference? Look, a baby has 100% stem cells. Then it grows to age 20. You only have 40% stem cells left. 60% will use up for you to grow. You understand? Right? So it's already depleted, gone. Sudah dipakai. All right? Habis. As you reach age 30, just 10 years later, wow, another 15% gone. Left 25%. Then age 60, this is where all the problems start to come. 55 onwards, right? You will find that you're aging very quickly. You walk also other issue. Your knees, all the problem. Diabetic, high blood pressure. Why? 5% stem cells left. Try cutting yourself now. It will take months to heal. 3 bulan, bukan 3 hari lagi. Betul? Because depleted stem cells. So these are the sources of stem cells. Embryonic stem cell is not advisable. This is done in Ukraine. They have what we call that human farm, where they have young women getting impregnated, okay? And then they take the embryo and they inject. A lot of people will go for embryonic stem cells when they are 60 and above because there are a lot of side effects from embryo. Okay, very dangerous. I won't tell you about the side effects now, but in the detail one I'll tell you. Or you can take from the placenta cord stem cells, or like what we do from bone marrow, blood, or fats. Now in countries like Japan and Korea, you are not allowed to use third-party stem cells. You can only use your own stem cells from your body. So we extract from bone marrow, blood, or fats. In Japan and Korea, they cut you open and they take from your fats, adipose tissues. Then they cultivate, then they inject the stem cells back into your body. After 21 days, some 90 days. 90 days you get better results. 21 days, not so good results. But if you are 65, okay, and you're sick, what do you think those stem cells will do for your body? Will it work? You're already sick, right? So those stem cells may not help you. But if you are young and healthy, then it will work. So adult stem cells, these are the concerns when we take stem cells from your body. There is a risk. We take it from the patient, press it, and then we administer and inject. But there are risks. There's pain, there's infection, contamination, and as I mentioned just now, limited potential because you're already above 60 and you have disease. And those stem cells are not healthy. So it doesn't really work for a lot of people. So the success rate for autologous taken from your own body is very, very low, right? Some people do get good results, but very few get good results. So the better way is allogenic from the newborn baby. Adult stem cells and cord stem cells. So cord stem cells we take from a umbilical cord of a newborn baby. So that is called allogenic. And in 30 days, you get 1 billion cells. Whereas if you take from your fats, the adipose tissue, after 30 days, only 200 cells. So now you understand why you pay a lot of money, but you don't get the results. So a lot of Singaporeans are now flying to Japan for this kind of stem cell treatment. I do not know who is doing the marketing, but they're very good in doing the marketing because lots of Singaporeans are flying over there for those stem cells, which don't really give them the results that they desire. So it's better to do allogenic stem cells. In Malaysia, allogenic stem cells are legal. So we don't have to follow Japan or Korea. But legal also, the word is, we are still in a gray area. The government have not really approved stem cells treatment. Okay, so that's why later on, Dr. Lim will tell you why we can use AFC as an alternative. So we specialize in MSC. Can you see that? Mesenchymal stem cells. So we have 2 products afterwards. The Subarashi triggers MSC in your body. So we have 2 products afterwards. The Subarashi triggers MSC in your body. So you can use that as the alternative to stem cell treatment. Okay? So the ability to self-renew, wow, right? The ability to differentiate into different type of cells. So if you have kidney issues, these MSCs will travel towards your kidney and repair your kidney, right? But if you're doing dialysis, what do you think? If I were to give you a stem cell injection or IV and you do a dialysis, what will happen the next day? Cuci darah. Habiskan lah, semua dicuci juga. But if you consume this, you see the difference? When you consume oral, your own body, your own bone marrow trigger and release the MSC. This is the difference, okay? So big difference, and also the price, big difference, all right? Being able to isolate from different sources. So you look the chart on the right, it will travel to wherever your body requires. So like some man says, I do a lot of hiking, then I have knee pain after 3 years. Hiking is a good exercise, but when you come down the hill, that's where your problem starts. All the braking, when you brake. So the knees are the one that hurt the most. Climbing up, wow, very good. You perspire, you enjoy the hike. But the downhill is the one that's going to hurt you eventually. So the first few months, still strong. But after 3 years, all the knees start to deteriorate. So your cartilage is gone. That's why we have to do injection into the knee for those who have knee issues. I'll give you the solution already to your problem. Umbilical cord, mesenchymal stem cells. So do you know what's umbilical cord? The newborn baby, right? They have to cut it and then medical waste incinerate the umbilical cord. So what do you mean by homing? That's why I mentioned just now. If your knee have issues, the stem cells receive homing signals because the brain is very smart. The knee then says, I'm in pain. So the brain will send the stem cells towards the knee. Oh, you are diabetic, right? So your pancreas have issues. So it will send the stem cells to your pancreas. This is how your body functions, all right? Then it attaches itself to the microcapillaries, but look at the next slide. It does not become the liver, does not become the kidney, right? So a lot of people in the market says, oh, if you do stem cells, right, it will replace your liver. No, it doesn't work that way, yeah? Don't be misled, right? You can do your own research nowadays. So these are the key properties of the umbilical cord stem cells. Inflammation. A lot of you understand inflammation. Inflammation is the key problem for a lot of people. All right, heart diseases, you get a heart attack because of inflammation. So all these stem cells will help you reduce inflammation in your whole body. You look at rheumatoid arthritis, multiple sclerosis, these are autoimmune diseases as well. IBD, type 1 diabetes, psoriasis, asthma, thyroid, blah, blah, blah. Type 1 diabetes as well, all right, because genetic. Type 2 diabetes is easy to treat, but type 1 definitely is harder to treat, right? So, but stem cells can do a lot of miracles. So instead of paying a big, huge amount of money, you can actually opt for lesser amount. Now, look at 1, 2, 3, inflammation, all these heart diseases, autoimmune, and regeneration. So that's the last one where you want to see. We regenerate joints, the spine, the brain, right? This is what stem cells can do for you, all right? RA, rheumatoid arthritis, MS, multiple sclerosis, PKSN, Parkinson. Anyone here in this room know somebody with Parkinson? Stem cells can help them a lot. Okay, so if they can't afford those injections, they can actually go for the oral. All right, thank you. So let me tell you something a little bit more about stem cells. Today in the market, there are live stem cells as well as frozen stem cells. Now, do you prefer to eat a frozen fish or a live fish? So you go to a restaurant that says, oh, I have 50% discount on the, what do you call that, the Sun Hop. Yeah, because it's frozen. That's why they give you 50% discount. Live fish, no discount, right? Because they will steam it and you pay a hefty price for it. So today is the same. So there are some people in this room maybe have done cell banking. You know, when you have delivered a baby 10 years ago, you store your baby stem cells. It was very popular at that time. Because technology at that time and technology now has evolved. 10 years ago, you made the right decision by doing cell banking. But today, if you ask me, the answer is no. So 10 years ago, you were doing cell banking and that was the right decision. Today, if I were you, right, because of technology, we can now do allogenic stem cell treatment, live stem cells from the baby to you. Within 14 days, we can cultivate and inject the stem cells into your body. That's what we are doing now. 10 years ago, that technology was not available, right? It was still autologous. We have to extract from your fats or from your blood. So remember, science keeps evolving. So today, a lot of people don't understand stem cells, and there are people who are saying that, oh, can stem cells be in a product? The answer is no for the time being. There is no technology that has, what we call that, to put stem cells into a capsule or into powder form yet. We call it lyophilized. But Taiwan, Japan, and China are doing research on this. Maybe 20, 30 years from now, that could be possible. All right. Now, I'm a graduate from ISCA, and now ISCA is promoting peptides. So later on, Dr. Lim will talk on peptides. Today, the world is moving more into peptides, but peptides has been around for many years. All right. So this is a very, very important ingredient. Yeah? So which Dr. Lim will mention later on. So my topic on stem cells will just end because it is to let you know that you need stem cells because you were made from stem cells. And you need new baby stem cells now to become younger. We don't want to talk about anti-aging. We want to reverse aging. Betul? Yeah? Anybody want to look 20 years younger than you are? Right? See, Shannon already put her hand up.